was given marijuana, so it helped her. But that's just a personal experience.
One of the arguments made by medical marijuana advocates is that, well, if you legalize it in this way, you can regulate it, and then what you're saying about pesticides and bird droppings, well, that'll go out of the window because now you can regulate it. What would you say to that?
We can regulate marijuana. That molecule that they're going after in the marijuana is already in a pill. Now, there are some issues with that pill, but again, if you teach a patient how to take it for its best effect, they can get the effect of it. It's not something that gives you a rapid onset of action like smoking a joint would do. But, you know, I have seen cancer patients who've used it who take it in advance of their trip to the hospital before they get in that cycle of smelling alcohol, thinking about their chemotherapy and becoming nauseated. So it works quite well when you have not allowed that nausea to be conditioned relative to the treatment. And individuals who have brain metastases who are going to get radiation will use it in advance of that. But those who have those brain mets, and a good friend of mine that I knew from med school died of lung cancer that had metastasized to his brain. He didn't take Marinol on the days that he was going to work. He only took it on the days that he was getting radiation therapy. But he too wanted a pill that had passed the test of science. We have that available to us. And they're reformulating it now so that it's a nasal spray, it can be delivered more quickly. Some of the problems that people have had with it are being overcome by reformulation. And there are lots of new medications under development that are going to take advantage of the molecules in marijuana. But we are not going to subject our young people to untold supplies of cartel-provided marijuana. Because don't fool yourself and believe that this mature industry that distributes drugs illicitly in this country is going to go away just because you can buy Marinol at the local Clark gas station. It'll operate in secrecy at great profit and continue to sustain itself and bring down every democratic process in every country from Canada to the farthest reaches of South America in this hemisphere. And it will have the cover of an ill-conceived law.
The people who are putting forth these ballot initiatives and whatnot, what are they missing? I mean, what aren't they seeing that you see?
I think that some of them are using the sick and suffering to advance a policy agenda. Some are upset that marijuana is illegal. As I said, if it were legal, you wouldn't have medical marijuana because they'd have access to it. So they're using the term medical. There's no such thing as medical marijuana. There's just marijuana used by sick people, and sometimes not so sick. In one state you can use it for writer's cramp. But they're using people who are sick and suffering to advance a policy agenda in a very slick and well-funded way. And these people who are, working with your sick and addicted in the state every day don't have money to put together press conferences and, fly people around the state and hire lobbyists to advance their point. All they have is, a reasonable argument.
Do you all have reason to believe that that's going to happen here in Ohio? I mean, we're very early in this ballot initiative.
Yeah, we are fairly sure that they've been. We've been tracking this for quite some time now, and there are no less than 3 initiatives out there now to put it on the ballot, which would be on in our Constitution. They're collecting signatures now. They've gone through the proper process to get them to the point where they can now collect the 380-some thousand signatures. And so as we kind of follow, and as just a follow-up to the thing, that we know that they're going to do it because they're fairly transparent. These are large pro-marijuana groups that have been working on these issues for 20, 30 years. And they've gotten to the point now that their transparency is that they have told us, through their websites and other papers, that this is one of their strategies to basically legalize marijuana. And they're brilliant at it because they're getting close to doing just that. If you look at the latest initiative that's been put out to go out for signatures. It's not medical anymore, it's therapeutic, and you don't have to have a doctor's recommendation, you just have to have a diagnosis. And if you get a diagnosis, you can have as much marijuana on you as you want to smoke or give away or do whatever you want to. And keep in mind, 1 ounce of marijuana is 84 joints. So when you think someone has a small amount of marijuana on them, that's 84 joints that'll keep them high continuously for 2 weeks. So America marijuana will flood the market. And so there'll be a lot of extra, which will get into our kids. But yes, we do think it's coming, and we really want to hear the experts, not me.